for. But before we do that, I have to say, we're going to get through this, and we're going to get through this together. So the first update I have is for the Team Kentucky Fund. On the Team Kentucky Fund, you will see that we have raised over $3.5 million to support our fellow Kentuckians. And the best news about raising these dollars is our partnership with the Community Action of Kentucky. Because of this partnership, not only are we able to help Kentuckians immediately, but also in the long run. So for every dollar that we have raised in the Team Kentucky Fund, because of our partnership with CAK, there is $1.70 that is given to our fellow Kentuckians. And so I want to praise them for their leadership on this fund. So if you are someone who is thinking about donating, you can go to donate.ky.gov. And if you know someone who needs assistance, please direct them to teamkyfund.ky.gov, or they can go to their local community action office, and there is one in every county across Kentucky. Just to give you an idea of some of the expenses that are being paid through the Team Kentucky Fund to help folks who have fallen on hard times, our top categories are here. Electric is $101,000. Food is over $123,000. Mortgage again is over $100,000, and rent is creeping up on it's $410,000. So of all of that, the vouchers that have been issued to support Kentucky families are almost 2,500, and that is going to support over 1,000 households in Kentucky. And so I want to thank, again, Community Action for your help, and for everyone who has donated $5, $10, $15 to help their fellow Kentuckians. Okay, the second of the Fast Four is our general election that is coming up. And so I want to make sure, this is the civics teacher in me, that everyone knows how to request their ballot. And so make sure that you go to govoteky.com, and you can see right there on the screen everything is laid out as to how that will look. The sooner you request your ballot, the better. And I would even recommend that as soon as you get your ballot, you fill it out and you send it back in, and that would help fight any worry that you may have leading into this election. They always say vote early and vote often. So next is the third is the census. Many schools across Kentucky have started back this week in some form or fashion, and it's really important to remember that as we fill out the census, we are provided funding based on those census numbers, and one of the areas that we support with that is public education. And so keep in mind that for everybody who knows we need more and better resources in our schools, make sure that you fill out that census and move us up the line. We are right now ranked 20th. I'm like Governor Beshear. I don't like to be down the line. I want to be number one. So we got to continue to fill that census out. You can go to 2020census.gov to do that. And last, but certainly not least, is some social media from the first day of school for so many folks. First here we have a post that is from Beechwood, and as you can see, this teacher is saying that she starts her school year with her why. Why do I do this? Why do I get up and teach every day? And as you can see, the answer to that is pictures of her students. And so I know so many teachers across Kentucky have missed being able to hug those kids and welcome them to their classroom, because that's why we do what we do. But things like this certainly help us to get through it with her Instagram wall. Second, we have a first day of school picture from Atherton High School, and they say that 9th grade will look a little different this year, but it's really good to see them, especially wearing their masks. So thank you. Next, we have one from Blake Elementary, and you can see that they say they're smiling behind the masks. I don't know about you, but I smile at people when I have on a mask, and I wonder why I do that, because people can't see it. But they can tell in your eyes when you're smiling. And so they're really excited to start what they're calling NTI 2.0, and to meet their students through Google Meet. And so thank you guys so much for doing that, Blake Elementary. And lastly, we have the Team Fields kiddos are ready for the first day of school, and as you can see, they have their classroom set up, and they are ready to go. It looks like this is from Iroquois and Brandeis Bears, and Carter as well in JCPS. So hope everyone got off to a great first day or first week of school. Continue to mask up, Kentucky, and remember to donate to the Team Kentucky Fund if you are able. Thank you.
Well, thank you to our Lieutenant Governor. I think switching it up a little bit, which we did today, keeps everybody on their toes and hopefully continuing to tune in to get information as we move forward. It's an opportunity each day when we do this to not only update you on where we are and the challenge of our lifetime, but also to tell you about the different steps we're taking to combat it. For instance, we believe that we will have a new announcement on childcare on Monday. But it's also an opportunity, since we have this chance every day, to also let you know about other things going on in state government, and with the interest, especially in COVID, a chance to learn about more of state government, how it impacts our lives. Today, I am wearing the Youth Performing Arts School in Jefferson County Schools. They call it YPAS. We appreciate them showing their spirit. They began with NTI and will continue that until, I believe, at least September 28th. We appreciate them for trying to do the right thing. I want to go back to one Team Kentucky Fund slide. This one made me proud, not that one, though that's good too. This is where those dollars are going. Team Kentucky Fund are people and corporations helping out people in need. This is truly people's charity in time of crisis. And looking at that, I mean, it's not quite $500,000, but almost in rent already paid out. And remember, we're going to be using more of this Team Kentucky Fund to help those that have gotten really far behind in their rent, because we want to help you not just in the crisis of today, but ensure that you do not emerge from it with too much debt tomorrow. We want to try to emerge from COVID as whole as we can be. That's going to be hard. But we've got to work as hard as we can every day to be as close to whole as we can. And that is financially, it's mentally, it's emotionally, and boy, that can be challenging. And we're seeing it being challenging on everybody, including me right now, on this traditional time that our kids would have otherwise been back in school. But listen, the virus doesn't care that we get tired, doesn't care that we get frustrated, doesn't care that we want to go back to our lives. It's just as aggressive, it's just as deadly, it's killing people we know, and so it's up to us to be strong enough, to be resilient enough, and the repercussions, if we don't, they might not happen to us, but they will happen to somebody else. So, we can be tired, but we shouldn't be tired of loving our fellow human being. We shouldn't be tired of living out our faith, of treating our neighbor as ourself. You know what? I mean, when our faith is tested, when our values are tested, when our resilience is tested, it says a lot about who we are. So let's make sure we continue to mask up and do it right. Today's report, 696 new cases of COVID-19. More cases than we want to see. 16% of them, 114 cases, are kids under 18 years old, continuing to be a larger and larger piece. Some school districts that either are opening or have opened, some concerning numbers today: 3 school-age kids in Barron County, 3 school-age kids in Callaway County, 9 school-age kids in Warren County today alone. That's 23 school-age kids in Warren County testing positive in the last 4 days alone. Again, we hope people out there will make good decisions, especially those in charge of our youth. This is a difficult time, but we need to be wise. We need to make sure that we make decisions based on science, on what's in the best interest of those we serve, and not just based on complaints. When we start making decisions based on that, on comments on Facebook, then you very quickly let the small group of folks that are upset know how to steer your decision making, and that can't be how we do this. We will not make it through as intact as we should if that's the case. So if you're in an area where you think you've made a wrong decision, and there's always time to make the right one, especially as these numbers pile up. Total number of cases now since March the 6th, 45,230. And that's pretty incredible. It shows you how quickly this thing has spread from something that didn't even exist first in this world that we know of, then on this continent, or then in this state. But this is our reality until we get either a really effective treatment or a vaccine. So this is our battle. We are writing our own history. How well we deal with it is up to us. Let's rise to the occasion, rise to the challenge. We've now conducted over 839,454 tests. Here's our good news of the day. Our COVID positivity rate dropped below 5% again. It's 4.64%. Now that's one of the lowest numbers we've had in the past 4 or so weeks. It's still too high. And notice it bounced below 4 to above 4 yesterday, so we're going to expect to see it rise and fall. I don't think it will stay under 5 over the next couple days. But again, we were going up towards 6, and so this is one positive sign that's out there. But it can't be the sign we're looking for. It has to be a work in progress. To get it down below 4.6, below 4, that's where we need to be going. So I hope it at least gives people a little extra energy to say it is possible that we better our situation when it comes to this virus. 606 Kentuckians currently hospitalized because of COVID-19, 146 in the ICU, 96 on a ventilator, so let's pray for them. 7 new additional deaths due to COVID-19, and again, remember these have to go through a committee. I can tell you that sadly we're going to be reporting a bunch more in the coming days. They include a 50-year-old man from Jefferson County, 50, 79-year-old woman from Greenup, 83-year-old man from Whitley, 89-year-old woman from Boone, 81-year-old woman from Graves, 91-year-old woman from Oldham, and an 89-year-old man from Jefferson County. New cases by county. Jefferson, 136. Listen to this next one. This is how things, when we say, oh, but our county doesn't have a lot of cases. Remember, it's a region. Our counties are tiny in Kentucky. We've got 120 of them for 4.4 plus million people. Todd County, 48. How quickly it can happen, how quickly it can grow. Warren County, 47. Christian County, 41. Madison, 30. Fayette, 27. Scott, 26. Bullitt, 23. Lewis, last couple days, in the double digits, I believe, 21. Davis, 18. Jackson also has been making this list higher than we'd like to see, 11. Boone, 10. Kenton, 10. Rowan County, 10. And then we have 9 cases in Barron, Hardin, Hopkins, Monroe, Oldham, and Pulaski. And again, remember, no area is immune. Greene has another 6 on here, but the entire list will be posted online. Long-term care facilities. Let's remember that it is still such a threat to our long-term care facilities. It is why we have put in the guidelines that we have, and we've been recognized nationally, and if we don't talk about that today, we'll talk about it soon, for what we have done. Despite having one of the more unhealthy populations in this country, and that goes up in all age ranges, we have done better than the median when it comes to preventing loss and our number of cases inside these facilities. But this is going to continue to be a challenge. This virus comes for everybody, but it's especially deadly in this group. So 53 new residents testing positive, 25 new staff, 1 new resident death, 1 additional facility. Kentucky Child Care Facilities, 2 new facilities having at least 1 positive. We haven't been tracking this for very long, right? So it's really important that we find the right balance here, that we do this thing right. Already 162 cases. And, we have an individual that works with us here in the Capitol that at least for a day or 2 had her child's facility shut down because of a COVID case. It's very frightening when one of these things occurs. So 2 new facilities, 3 new staff. And just look at the number of staff. I mean, think about when we're talking about schools and people say, well, kids don't die from it. And that's a really bad way to make an overall decision, right? Well, kids don't die from it, so just do whatever you want. 132 staff, those are adults. It shows you how easily this thing can spread. Now, it didn't spread to all of them through the facility, but these are then people coming into the facility. And so I'm hearing a new comment being made, whether it's in different institutions or groups, saying, well, we had one positive test, but it didn't come from inside the facility. The virus doesn't care. The virus doesn't care. If somebody has it that's in your facility, it's spreading in your facility. So the same action needs to be done, whether you believe that somebody went to a party and then brought it in or anywhere else. You still deal with that reality and that situation. You still got to protect the people around you. Colleges and universities. So today, this one has really ticked up. 60 new students, thankfully 0 new teachers, 1 new school on our list. While this was not just in one day, but all the reporting came in at one time, a lot of that is driven by 25 new positive cases at Morehead State University, 27 new at UK. And remember that what we get trails a lot of time in this. We're still using our extensive report. We'll have a dashboard that ought to be a little more timely, but still trails what the local health departments put out or what the universities may put out themselves. Kentucky schools, thankfully just a couple of additions since yesterday. 2 new students, 4 new teachers. So again, this isn't just well, kids don't have adverse effects, and that's not true. That's people saying that kids don't die. Thank God. That appears to be the case. But 4 new teachers. Remember, these are people that do an incredible job, and all of us that are desperate to get our kids back in school know how hard being a teacher is because we're terrible at it as parents. Let's at least honor them enough to want to keep them safe. 4 new schools are represented in those numbers. You saw a little bit about the first day of NTI, but I want to make sure that we are also recognizing those out there that continue to talk about Mask Up KY. The federal government sees in our numbers that this is working. We see in our numbers that this is working. Wearing a mask saves lives. So are you willing to go through a little discomfort to save a life? Or is your position, my rights as an American mean I can refuse to do something that will cost people their lives? That's never who we've been as a country. We've been willing to sacrifice for each other, fight for each other. Hopefully, we can all do that right thing. So let's look at a couple things that are online. This is Michaela Epps, former University of Kentucky and WNBA Chicago Sky basketball player and Marion County native, asking people to mask up, serving as a good example. We appreciate Michaela. Here's the next. I love this. This girl is 3 years old. And you know what? She loves wearing her rainbow bright mask for herself and others. To her, it's not a chore. It's fun, especially when you used to play Dino Dentist. She's 3, and she gets it. She's 3, and she gets it. I hope we all can too. All right, next one. This is Tyler Murphy, Fayette County Public Schools and Boyle County Schools. Again, showing a little bit of what the classroom looks like right now, but serving as that encouragement to get people to mask up. And I love this. This is just one more NTI picture, but we wanted to show it. This kiddo is getting dressed the same way always did that he always did for school. So us adults may still be wearing the pajama pants as we're working at our computer during a lot of this, but our kids are better at keeping their old routines. All right, Dr. Stack has 3 or 4 things he's going to update us on, and then we're moving fast today. We'll open it up for questions and get out a little bit early.
Thank you, Governor. I do have about 4 things I'm going to share, but before I share those things, just a little shout out to some of our team at the Department for Public Health. So there's a wonderful spirit of cooperation across the different states, sharing information, sharing best practices, working together to try to help us all get through the pandemic as well as we can. And so another state has observed what we're doing in Kentucky for contact tracing, the technology tools we use, and the approach we've used, and has asked if we would be willing to share one of our teammates to come out to their state for a couple weeks and help them set up their contact tracing program in their state and to augment the efforts they have underway. So my compliments and gratitude to our entire epidemiology team, and in this case, to the epidemiologists who may be willing to go out there to the other state and share what we have learned here. Greg, if I could have my slides, please. So I have 4 things I'm going to go over. This, some of it is newsworthy here. So this has been in the news the last 2 days. The Centers for Disease Control has changed its COVID-19 testing guidance. And what I did here was just took the summary portion from their document. You can find the document right on their website. I want to make a few points off of this. The first thing is all of these documents are in evolution, right? We've said that all along. As we learn more, we evolve them and we change them to make use of the information that we've learned. So I just want to draw attention to that. That is normal. You should want us to do that because that's part of the learning process, and we get better with time, we hope. One thing I do want to point out on July 17th, at that time when they changed it, once you have become infected, once you know you are infected, there is now good evidence to say you don't have to get tested to show that you are negative. And so you should use medical guidance to interpret these documents, but if you are normal and healthy and had mild to moderate disease, after 10 days and 24 hours of no symptoms, you can return to activities and you don't need a repeat test. Now they've done more changes more recently on August 24th. These are the changes that have led to some controversy. In many ways, the guidance is good. The guidance draws attention to high-risk populations and nursing homes and actually says that for people who are in high-risk populations or who work with people in high-risk populations, you should get tested regularly and on a schedule, whether you are symptomatic or not symptomatic, because we know that asymptomatic people spread this disease perhaps up to 40% of the time. The part that has engendered controversy is that the guidance appears to discourage people from getting tested, even if you may have had a high-risk exposure. And in that case, if you're not symptomatic, the guidance create the opportunity to not get tested. This has a number of us in public health concerned. I don't know about confused. I was going to say confused, but concerned for sure, because we know that as many as 40% of people may be walking around infected and spreading the symptoms, but not, or the infection, but not having any symptoms or signs. So I would encourage you to still follow our guidance here in Kentucky. And it says right here in the document, if you read it, in areas where the disease is more active, testing may be required more widely, and you should listen to your state and local health officials. And so as your state health official, I'm saying the disease is more active in Kentucky. We are in that region of the country where it caught the White House's attention because it appeared to be moving north into the Midwest. And I would encourage you, if you have a high-risk exposure, to still get tested and not use this to justify a lack of need to get testing. It's very important to get tested if you had a high-risk exposure or have symptoms or are around anyone who is a high-risk population. If we could have the next slide, please. We have modified today our disease clearance documentation. This is because of another evolving topic. The entire concept of critical infrastructure worker and essential worker has unfortunately become fairly distorted as we've gone on. There are a lot of essential and important workers in society that do countless things that we all rely on. The federal guidance document that people refer to, the CISA document, describes critical infrastructure workers along the lines of, if you have collapse of major infrastructure in society, and you were otherwise to have things like food insecurity leading to starvation, if you were to have a lack of medications or healthcare workers to provide critical emergent healthcare needs, if you were to lose energy support and therefore you had a 20 below zero winter weather and no heat, those are things that can lead to imminent harm or death. that in that case, those certain kinds of critical infrastructure workers should be permitted to work, whereas others may be told to shelter in place or stay home. That unfortunately has evolved a lot over the last few months and changed a lot. And so now what we find, the local health departments are finding, is all sorts of people are claiming they are critical infrastructure workers and they shouldn't have to quarantine after a high-risk exposure. So we have removed from the document the reference in there that even mentioned critical infrastructure workers, because unfortunately that has been distorted beyond, I think, recognition a lot of times. So now the local health department will be the one that works with you to determine if you have to quarantine or not. The guidance applies to everybody. And for anyone who reads it and says, well, there's the reference to healthcare workers, the CDC has a very detailed algorithm you have to go through for healthcare workers if you meet certain criteria. And even in our document, it says only if there would be a severe shortage and crisis in the healthcare setting. And that's to make sure that surgeons and critical care doctors are there if the hospitals need them for patients, but they have to go through a lot of steps before they get to that. So we have removed the reference to critical infrastructure workers to minimize the risk of ongoing distortion of what that was intended to do. Next slide, please, Greg. I want to make a reference here to the White House report that I and the governor have referenced. So I think it's for about 2 months now the White House has been giving us these reports. And I again hear from local health department leaders and other leaders throughout the state some degree of reported confusion about our use of these different data sources. So I just want to be explicitly clear again. We are trying to give you all the data we have as we have it, in trying to help you see the things we are using in a multidimensional process to try to make complicated decisions in a continuously evolving situation to recommend what we think is hopefully in our all collective best interests and safety. So the White House report shows, and the governor's shown a version of this before, red and yellow counties. They describe their own methodology for how they arrive at that. The White House Coronavirus Task Force is the curator for that information. So they're the ones who are accountable for how they produce it. And you can ask them if you have any additional questions about how they produce it and make those decisions. That being said, they produce a lot of information, and there's a lot of useful information in there. And they provide in the report maps, and I want to draw your attention to these maps. The one on the left is called an incidence rate map. It shows the number of new cases per 100,000 people in population. The one on the right is the test positivity rate. The test positivity rate continues to be a matter of confusion for folks. What we have said in Kentucky is that the way the data is reported, and because not all counties get the same degree of data, it is difficult to get that at all the county levels with consistency. Now, the White House has different data sources and different approaches, and they explain again their methodology for that. We use these data points and a lot of others when we arrive at our recommendations for you. Our point is that whether it's the White House doing it or the state of Kentucky doing it, we're reaching pretty similar conclusions for a lot of these things. The disease is very active in the state of Kentucky. We are at an elevated risk for spreading COVID-19, and if it spreads uncontrollably and gets out of control, you then have increased hospitalizations, increased deaths, and overwhelming of the healthcare system. So I just want to draw your attention to this report again, because we've now made the decision that we will post this on the website. So I had 5 of the reports available. I don't know where the first 3 are, but so I've got the last 5 ones as of now should be posted on our website. And if you want to read these, you can go right to the website and click. It says White House Coronavirus Task Force Reports, I think is the description. And all 5 of these are there. And each week when we get it, we'll add the new one after we've had a chance to present it to you. Next slide. This is the last one. This is a shout out to another part of our team. There's a lot of folks in state government and government across the state and the local level who are working very, very hard on your behalf. They've worked long hours. They've gone above and beyond. And because it is state government, my ability to reward them other than expressing my gratitude is somewhat constrained. So thank you to all of you for all you're doing. This is our warehouse. We have more than doubled our warehouse space during this journey. When I went to the warehouse as a new commissioner back in early March for the first time, I have to say, I was a little bit depressed. Not because it wasn't a pretty warehouse and all, but it was a large empty warehouse. We had a few rows of materials, which are probably appropriate for normal situations if we had a one-county flood. They were entirely insufficient for our needs for this kind of statewide emergency on a sustained basis. So I went and visited the warehouse workers yesterday for our preparedness branch and had a tour, and I just took these are just a couple pictures of the row after row after row of shrink-wrapped gowns, gloves, masks. And so this is intended to be an emergency supply should the supply chains get disrupted and should we have to support acute health care and first responders in the state. So this is not a rainy day fund for day-to-day use. This is for if things fall apart, and I think the governor's already expressed, and I'll reiterate, we are already having signs of supply chains for PPE and for testing materials drying up and running the risk that we could run into shortfalls as the fall unfolds. So I hope that this gives you some assurance that this many hard months of preparation, we've built up some reserves so that we're prepared in time of need. So it's been a lot of hard work. I'm proud of the team, and Governor, thank you very much.
Before we open it up for questions, I just want to be a little more explicit about the CDC's sudden change, saying those that have had direct and high-risk exposure to somebody who's tested positive to COVID shouldn't be tested. That's reckless. It contradicts everything that we know and have learned about this virus. It is inexplicable. And in Kentucky, we're going to still continue to do the right thing. I believe the CDC is going to change that new guidance. It doesn't make any sense at all. Let's make sure we're doing the right thing. And I mean, come on, it's common sense. If you've been directly exposed to somebody who has COVID, don't you want to know if you have it? Don't you want to make sure you're not spreading it to somebody else? Don't you want to make sure your kids don't have it? So keep getting tested. And this thing, I think, will be a blip. I think it'll be changed, and we'll get back to the right advice. All right, we got a lot of reporters here. The good book says the last shall be first, and I think Debbie had to go last yesterday. So why don't you start us off?
If you think the CDC decision is reckless, where do you think it came from? I've seen some suggestions in news reporting already today that it is part of the White House desire or the President's desire to lower the number of positive tests.
The question is, where do I think that the CDC guidance change came from? I've seen the same things on the television that other people have, but I have zero information on what the actual cause is. Now, I think for the first time, we have Natalie Parks, and are you the editor-in-chief of the Kentucky Kernel?
So my question is about UK student rates, and according to the Lexington Fayette County Health Department today, 507 UK students have tested positive, and the UK administration has not committed to a specific number of cases or a specific positivity rate that they would shut down or move to remote learning at. So I was wondering if there is a case number or positivity rate that the state is looking at as the threshold to step in for a shutdown.
The question is, and this shows again how our data right now, because of the way we're putting it together and its reporting, trails what many times universities are putting out. Can you tell me the number again? 500? 507. 507 positive cases related to the University of Kentucky. I know some of those have to do with everybody being tested when they first came back on campus, but a whole lot of them being since. That is a lot of cases, and it should raise concerns. I know additional testing is being done. I would like to hear from the university, at what point do things become such a high level that you consider making major changes? Part of that could be an explanation by the university where they're seeing it and why that might not require these steps. But once you have 500 plus cases, and at least 300 of those I think are since, if not more, maybe it was 100 and something from when people originally came back. 276 from the first day of classes. It's a real concern. And so my hope is that we will see more information and more analysis from the university itself. Also want to point out, we've talked a little bit about sports the last couple days. SEC requiring those 3 tests a week uncovered some positive cases. I think with UK, they'd uncover them other places. That's not a criticism of the team. It's actually a real positive for the team doing that level of testing. And so we have to really think about anybody out there who is engaged in high contact sports. You need testing. You need to get your kids tested. It's the responsible thing to do. To be doing contact sports without having any testing at all would basically be to say, we know we have the virus, we're going to stick our head in the sand and hope everything would turn out okay. Joe.
Kind of bouncing off the discussion, the president has been critical of testing policies in the past. How concerned are you about politicization of testing, especially in light of the new CDC guidelines?
So the question is, the president's been critical of the increase in testing, certainly over the past couple months. And am I concerned about the politicization? Yeah, close enough. Yes, I am. I can tell you the White House task force has been working to increase testing and pushing us every day to increase testing, of taking different labs where it'd be really hard to turn them on for COVID testing and to turn them on. Every drumbeat that we hear and that we are pushed on from the Vice President and Dr. Birx and that task force is to increase testing. And so it appears that there is a disconnect going on somewhere there in Washington, but we need more testing. When you test and there's a positive, you haven't created a case, you've discovered a case. And the only way to prevent spread is to discover cases, contact trace, and quarantine. And if we don't do that, if we don't try to do that, we don't win against the virus. If 40+% of cases are asymptomatic, then all you'd know are 60% of those people who are positive on any given day, and everybody else would walk around and spread it. I'm concerned about what's become political about every part of dealing with a worldwide health pandemic. And I got to tell you, it's frustrating and disappointing. It is incredibly disappointing that in the major battle of our lifetime against a virus that doesn't give a darn about whether we're a Democrat and Republican, everything seems to get political, and people get angry about doing something that we know could help save lives. I mean, mostly what we're seeing is the best parts of our character during this, but we're seeing some of the worst as well. Not political. It's a virus. It's a virus. It doesn't care about political affiliation. Decisions made aren't liberal or conservative on it. They're just either right or wrong, and they all come with a different death toll. Tom.
There was testimony today before the Health and Welfare Committee by a representative of the child care industry saying that if there's no relief, 45% of child care centers could go out of business by November 1st. Is this what you're going to announce Monday, perhaps have some relief for them?
So the question is on child care. As you know, we have invested more than $46 or $47 million thus far. No, we've invested $67 million. I shorted Eric Freelander by $20 million right there. $67 million to suggest that this administration doesn't believe in child care, and we deeply, deeply do. After putting $67 million into it would be wrong and would just be trying to make this thing political. What we have to do is balance the dollars and the cents. The number of kids that should be in a classroom right now can't just be based on what's the break-even mark at a child care facility. It's got to include that concept, but it's also got to be based on public health. And if it gets to a dangerous level, I mean, look at the number of facilities we have after just a short time. It shows that COVID spreads through them. I do believe that they will get some relief on Monday. I believe it'll be a plan that will help, but will it put 30 kids in every group? No, that is not okay. It is not safe. And while you have some industry representatives who are oftentimes lobbyists, it's their job to push as hard as they can for folks. We got a whole lot of other people out there that want to make sure they're doing this right and that are not spreading it, and where hearts and minds and are together in the right place. Let me read. Okay.
Changes. We could talk about the task force's desire to increase testing, but it was actually a prominent member of the task force's testing czar, Director Rohr, who said today that this guidance has been updated to reflect current evidence and best public health practices. Are you or Dr. Sack aware of what he may be referring to? And do you have a call plan with members of the task force to seek clarification?
Apparently, one of the testing SAR came out, and I haven't seen comments about new guidance about people that should definitely be tested. Not getting tested is based on new science or evidence. That would be new since our last call, or everything that's been told to us. Listen, I'm not going to speculate on the why on this, but it's bad policy, and I don't want people in Kentucky doing two things. Number one, saying, well, they say I don't have to get tested. I may well have it, and I'm just going to go out and do what I want. I mean, that just spreads the virus. Or two, trying to say I have the virus or I'm quarantined, but I should be called essential, which means I don't have to be at home anymore. Again, that's spreading the virus. The number one thing here is about beating the virus. And if that means that we have higher numbers of cases because suddenly we can find out every case everywhere. Listen, if we did that today, if we could test everybody in Kentucky, we'd have a heck of a lot more than 600 cases. But guess what? We could immediately start the contact tracing, the quarantine, and we could be through this thing a heck of a lot faster than we will ever see it. More testing, and more testing is what every public health expert has repeatedly said. It's what we've been pushed on.
CDC situation. So, I mean, are you worried at all that there's some people out there that will look at you for advice, and next thing you know, they're looking at the CDC, then they're looking back at you, and they get lost? I mean, do you think that's going to happen?
Question is, am I worried that people hear from us what to do, and then the CDC comes out with something that is the opposite of what they said the day before? Am I worried that confuses people? Yes. Do I think that the advice is wrong and is reckless and is contrary to everything we know about the virus? Yes. Again, I haven't criticized Washington much, but this one hurts us all. Again, virus doesn't care your party. It comes for your parents. Virus doesn't care about your party. It may create a heart condition in your kid that we're seeing. Virus doesn't care, but all this goofiness, it just makes it all harder. Hayden.
Represent a community. Of course, there's restaurants everywhere, but Louisville is known as a food town, and that is the lifeblood of our economy and our city. A lot of people ask me if you will have any updated guidance on capacity change, or perhaps how long the curfew will remain in effect.
Question is on if we have any new thoughts on capacity change. And then curfew, and I'll take them one-on-one with restaurants and bars. Right now, I mean, the White House generally has said 50% of everything, and going beyond it is a real problem. Capacity inside more than 50% in restaurants would be a real problem. And remember, the White House still in many counties thinks it should be at 25%, but we're trusting our restaurants to make sure that they do things right and continue to push people outside. We're providing more flexibility right now than what the Trump administration is suggesting, which is a lot harsher rules and regulations on it. The curfew, we're doing so that we don't have to fully close our bars and we can provide a place for people to go instead of big house parties. If we did not have the curfew, then we would probably have to close them all, and that's what the White House continues to push. So again, we're trying to help small businesses, but I hope they understand we're being more flexible than even some of the national advice that we get, and I've got to be responsible for that if it doesn't work. Let's see, is there a mechanism for ensuring individual schools are reporting cases? As we have our reporting methods that are up, we're certainly, the dashboard that we're creating requires inputs from individual schools themselves. So as we go forward, everybody will end up in that system. If reports aren't made, is there a penalty? Well, if reports are made to a local health department, if it takes a little while to come around to us, but the community knows about it, then we'll fix that as we go. A school that would intentionally hide positive cases, and I hope that is never the case, then yes, there'll be penalties for that because your kids aren't safe if there is an institution hiding positive cases. That's our job to do. It sounds harsh, but I think everybody would expect that if people are putting kids and teachers at risk and then not being honest about it, that we do something about it. Debbie?
A couple of lawmakers continue to question the state's data and positivity rate, and the gist of the question seems to be that not all negative tests are reported. And I know Dr. Stack has mentioned this before, but I wonder if he or someone could explain what this is really.
So all negative tests from every lab that we know about and every other group are required based on, yes, what we have put out, and we continually see letters to be sent in. We send every lab that we know about letters saying, report your negatives, report your negatives, report your negatives. Now, could there be a new lab that doesn't start doing it and we have to go out there and find them? Look at how many there are. But we are pushing every single group to report negatives. But again, those that are criticizing the data, they don't have any data. None. It's just that I don't want to believe what's out there because I don't want there to be a problem. And again, if you're going to address a problem, you got to recognize that there is one. And Debbie, there's a worldwide health pandemic. There's certainly a problem. And these are folks that didn't think that there was concern about going back to school. And look at how many schools we already have that have closed in one public school system. And already some issues arising in other places. We have tried to give good public health, non-political advice, but I can't help it if there is a group that just decides they're against whatever we're for. They were against the mask mandate. They are against steps we took about visitation at a time when it was absolutely necessary. I mean, if your decision is just to be against whatever we're trying to do to keep people safe, there's not a lot I can say to that.
So Kentucky has been in a state of emergency since March. And because we're in a state of emergency, public agencies have 10 days to respond to an open records request, which is triple the time they had previously. Will that rule about the 10 days last as long as the state of emergency does, or is there a possibility it could be amended for it to go?
That's a good question. The state of emergency the question is about open records request and the amount of time you have to respond to it. I believe they put that in statute, didn't they, near the end of the last session. It would depend if it's in a statute or if it was just in the emergency order. If they put it in statute, then it's going to last as long as the state of emergency continues. If not, there's something that we can do about that. I think it's a good question. Let us make sure that we get you the fully accurate answer. Debbie, do you know? Did they put it in statute?
I didn't know. I didn't realize they did.
Yeah.
I think it's terrible.
Good editorial comment.
Testing supplies. I know we've been talking about the last few days that we're concerned, but
Yeah.
those things are out.
The question is, where are we at with testing supplies? And it ends up being a more complicated question because there are so many different platforms. Think about them as machines and different things that have to go into the machines and different things that keep the machines running and sometimes different collection supplies for the machines, though most of those are similar. What the federal government to get testing up is they encouraged us to create every platform that we possibly could. And so now what we're seeing is supplies are running really low or even out across many of those platforms. We made a request to the federal government for a half a dozen, if not more, different supplies on different platforms. Most of them the federal government can't help us with, so it's not good. It is not good. Now, our state contracts with Gravity and most of our other state labs are in a better place than most of the nation with their platforms. But it's a real concern, and right now we don't see it getting any better on certain platforms. But the positive here, and we'll see how long we can keep it up, is Kentucky is one of the only states that we haven't seen a big drop-off in testing. So people are doing a good job on that, and I hope the CDC's misguidance doesn't harm us in still continuing in the right direction. Dr. Stack was a lot more reserved than I've been on this. Tom?
We've had the medical strike teams, for lack of a better term, that have been sent out to long-term care centers and what have you in the past. Have they been sent out at all recently, or are they on kind of just on standby?
Let me ask Secretary Freelander to come up. The question is on long-term care facilities and the strike teams that go out. I believe the amount of assistance, the amount of expertise, the amount of resources we provided to our long-term care facilities here in Kentucky battling COVID rivals, if not exceeds, what any other state has done, and they continue to work on that. So we'll let Secretary Freelander comment, and then I think you can tell the public good night when you finish up. But for everybody else, I'll see you tomorrow at 4. Remember, we'll get through this together.
Yes, sir. So the question was about the strike teams in long-term care, and I'll just take a second here. You know, that has obviously been a very controversial piece. I think there was testimony at Health and Welfare today around long-term care. And what I want to say is I know our response has been strong. We have provided strike teams. I don't believe we've done so recently. We've been looking at different ways and innovative ways to come up with more folks, working with potentially the National Guard. That's been a little more difficult as they've been they've been called and on duty. So in another country. So we have been creative in how we've done that. We've actually tried as much as we can to support the facilities through providing PPE, through providing testing. We've done that on a first round. We're doing it on a continuing basis while we await some response from the federal government. We knew we couldn't wait. And as the governor said, we believe we are around 20th in the country in terms of 20th best across domains in long-term care. And we've remained there for now several weeks now. So we're really solidly there. So in terms of the strike teams, we haven't had to deploy them recently. We've been fortunate in that, but we have been continuing to provide them support with the public health hospital-acquired infection team that has been supporting folks. I know the Inspector General, Adam Mather, has been, I think, on over 500 calls with facilities. Our Norton partners have been on calls with facilities. We've been supporting folks across the continuum of long-term care. So I feel very good and very strong about the support we've given long-term care. And when you actually look across months, you can see that we have actually been providing more funding as well. So thank you for that question, and thank you for the opportunity to say I feel really, really strongly about what we've done with long-term care. And now it is my pleasure to say we will get through this, and we will get through this together. Thank you.